Hello, my name is Mark Lever and I'm the Chief Executive of Helpforce, and I'm delighted to have Neil Churchill with me today. And he's the Director of Patient Experience at NHS England and Improvement. And we're going to be talking about the integrated approaches to volunteering project.
Hello Mark, good to be here, good to be with you.
So Neil, I guess the first question really is when we're thinking about integrated approaches to volunteering, a big project that we're delighted to be working alongside NHS England and Improvement on is actually why is volunteering important to NHS England and Improvement?
When we think about it more widely, I think there's something important around the triple benefit for volunteering. So volunteering is clearly good for patients. It's clearly good for the volunteers themselves, and it's really good for the NHS. So everybody benefits. And when you see some of the volunteering programmes that Helpforce have been involved in at the start and that you highlighted as good practice, you really see that patients get a better experience, they often get better outcomes. You see that the volunteer grows in confidence, they're growing their own skills. Some people may be looking to develop their career, other people are looking to give something back, but they get that personal benefit out of it. And the NHS improves, we provide a higher quality service, we meet more people's needs more consistently, and it can help us to really give a better service for those people that we may find it harder to support because they're on their own, and because we might not know as much about them, about their needs, and volunteers can really make a difference in all those ways.
I mean, clearly if we're going to expand the role of volunteers within the NHS, we need to be confident that there are actually going to be people out there who are prepared to do that. And do you have confidence that this will be something that will be attractive to people who want to start volunteering in the NHS?
And I think, so I've been talking a bit about hospitals so far, and I think the point around the integrated programme is that we really think that volunteers are a force for integration in themselves, because they do see the whole person, they get to spend more time with people, they're focusing on people, as opposed to people as particular clinical problems. And while we continue to celebrate the really important things that volunteers do in hospitals, what we're also excited about is the potential to connect with things that are going on in the community, and to really try and push care upstream in the way that the long-term plan aspires to do. And we'll find that we'll tackle some of the factors that lead to people having poor health earlier and more effectively. Will help to build people's confidence, build their skills, and it will be that force for integrated care that will sit alongside what public services can do.
Sure. To me, and what you're describing, it sounds as if volunteering could actually play quite a big part in joining that up. But clearly there are some challenges where you've had volunteers who've operated within an NHS trust or within the boundaries of a hospital, and you've got volunteers who are operating in a multitude of voluntary sector organisations in local communities. Can you see any challenges that we're going to need to really focus on to get those two to link up?
What I hope we'll see from the integrated volunteering programme is people thinking about, for the areas of work that they are trying to join up, where could volunteers make the biggest difference? Where are there volunteering programmes in the community that are addressing some of these issues? How might we stitch these together? Sure. And then we'll demonstrate that this thing we call integrated care, which on one level is jargon, isn't it? It means different things to different people. Actually is talking about more joined up care, more person-centred care around individuals in particular need, and they get better outcomes. And then I think once we've started to show that it works in particular areas, we'll start to build up, and we can see a more systematic approach emerging.
I wonder if you've got any thoughts on how we can better involve volunteers in identifying those opportunities, and involve volunteers in actually helping us think about how they can transform that integrated care pathway for patients.
Yeah. But I do think that volunteers have a lot of insight. They have a lot of insight about how public services work, how NHS organisations work, and where some of the bottlenecks are, and how you might overcome some of those bottlenecks. So it's really worth listening to them for that perspective. I think the trick with integrated care is going to be that because integrated care systems have got a really big, difficult, ambitious agenda, that it's really important to share that with volunteers and say, look, these are some of the big challenges that we're really trying to address. And how could you think about ways in which we could do that?
And I suppose that engagement with volunteers, helps increase the value that we feel for them as well. So I think it's a positive thing. I mean, just a final thought. Are there any boundaries at which you say, well, actually, that's no longer a legitimate volunteering role and actually probably is more a paid role? Do you have a sense of where those boundaries might lie?
I think the boundary question is an important question because we do want to make sure that volunteers aren't substituting for staff. The idea that Helpforce have come up with, which is that volunteers are really doing things that friends and family would be doing for a patient if they were able to, is a good one.
Yeah.
But I think we are in an environment where we are trying to learn by doing, and I think listening to staff and staff representatives and listening to volunteers and listening to patients is the way we should go. Let's experiment, let's try new things. But there's an awful lot that we know has a really big impact for patients, for volunteers and for the system. And I think if we focus on doing those things more consistently, then we'll reap a lot of benefit.
Sure. Neil, that's been fantastic, really helpful, really great insight. And hopefully folks who are watching have found that really helpful. Thank you ever so much for watching. Neil, thank you once again.
Thank you.